for H&F CMT-Connect webinar. Today we will be discussing telemedicine, which is on the forefront right now of medicine, and I think it's pretty interesting, a concept to be able to see doctors and get some medical evaluations virtually, which I think our world is becoming more and more virtual every day. So we thought this would be a fun topic, and we have a wonderful doctor by the name of Dr. G joining us tonight. I'm going to patch him through. Thank you so much for joining us.
Oh, thank you for the invite.
Yes. So maybe you can introduce yourself a little bit more and just go into more detail about where you're located and the type of medicine you practice and how you work with CMT patients.
Sure, yes. So as you pointed out, I'm a neuromuscular physician. My full name is Raghav Govindarajan. Normally, it takes about 6 months to learn my name, so I just go by Dr. G. I practice at University of Missouri, which is in Columbia, Missouri. And Columbia, as a town, is right in between Kansas City and St. Louis.
Okay.
2 hours either way. We have a multi-D clinic for our CMT patients, and the clinic is jointly run by me, the neuromuscular physician, and a rehab doctor. In addition, we have all the therapy services as well as a part of the clinic. And we have a fairly large population of CMT patients that we take care of. We are happy and proud to be associated with Health Neuropathy Foundation as well.
Yes, we're happy to have you in our community helping our patients. Can you tell us a little bit more about some of the ways you treat CMT patients at your facility?
Yes, so since the clinic is jointly run by me and the rehab physician, both the medicine part of it, in terms of patient care needs, in terms of management of symptoms, is done by me. In addition, I seek input and I also give input to my rehab doctor. And, that's a very unique model to have both of them in the same clinic at the same time. And she assesses the braces, the AFOs, and all of those. And we are able to provide a customized care for the patient, both in terms of the treatment as well as in terms of rehab and so on. And we have PT, OT, we also have wheelchair, we have social worker. We are able to provide that comprehensive care for our patients for our CMT patients who need them. The unique part of my clinic is that some of my providers, they themselves have different neuromuscular diseases, and they are going through that themselves. So they know what our patients are going through. So that's a very unique part that our clinic has, which not many clinics have. So
that's very unique. I would think that adds a whole other level of empathy when you're dealing with patients with CMT.
Absolutely, and that makes a big difference for our patient care, and that's what we strive to do. We strive to provide the best care for our patients, and we take all kinds of insurance. We also work with patients who don't have insurance. Our hospital has a way for accommodating all of them. We get referrals from all over the state and beyond as well. So we get referrals from all our neighboring states. So we take all kinds of things.
That's great. That's great. Can you tell us a little bit more about this concept now of telemedicine, since not everyone unfortunately can travel to you? Tell us how you kind of got started in this and just a little bit about how the process works.
Right. So telemedicine is at least in our CMT world, and even in any neuromuscular world, for example, it's still an evolving concept. Whereas in telemedicine in the stroke world, in the dermatology world, psychiatry world is fairly advanced and mature actually as a way of care. And it is pretty ideal for our patients. Especially many of those who are traveling far away, who have many physical needs, making that long distance drive for a face-to-face visit is a bit hard.
Absolutely.
And that's where the telemedicine comes into play, where you are able to provide care for patients in their home in many cases, um, or in a clinic nearby that they can travel to, um, and they can get the care they want through the use of telemedicine. Basically, what we are doing right now, this Zoom WebEx, is a form of basically telemedicine.
Right.
It is telemedicine in the sense that we are not providing patient care, but telemedicine in the sense we are doing education. So this is exactly how it works.
So walk us through kind of like a scenario where a patient would contact you for consultation, or I mean, what are some of the areas in which you can treat or evaluate patients? So what are some of the types of needs that you're able to address?
Right. So a couple of things, the telemedicine insurance laws and state laws vary significantly. Some states you can do, in some states you cannot do. In some states, if the patient is in a different state, you are in a different state. Some states you will have to have license in the state that you are there, as well as license in the state that the patient stays. So it's a very complex medical, legal, and regulatory field. So that's been one of the big barriers of wider implementation. Similarly, in terms of insurance coverage, some states cover it, some states don't. Medicare doesn't cover telemedicine for many things. It's recently started covering stroke for patients who, irrespective of where they come from. Um, Similarly, some private insurances they cover for it, some don't, some cover only for certain services. So again, that's a hard part of implementation.
Okay.
It helps the patients a lot, but the medical, legal, the regulatory, as well as the insurance coverage issues are not very clear as of now. They're becoming more clear and mature, and I think in future this would be one of the ways many of us will get care, irrespective of where we are going. But
Absolutely.
that's where the barrier is.
Right.
Um, Having said that, some of the ways we can provide care for our patients are whereby the patients stay in their home. They can have a secure link to our office where we have the telemedicine set up. On the day when the appointment is, me, my therapist, all of them can come at different times,
Okay.
see the patient, and talk to the patient basically through a web interface, and assess their needs. The only drawback there is nobody is examining the patient. We can still make the patients do something in their own home, stand, walk. It will also give us an idea about what things are going on in their house, to
Right.
assess for safety and so on. But the examination part may or may not be there. And in some cases, you may not need the examination part.
Hmm.
There's only so much reflexes you can elicit. After a while, it has no meaning. So
Right.
there's only so much pinprick gradient you can do. After a while, poking a patient has no meaning anymore.
Right.
So it might be better to assess the functional needs of the patient rather than do a routine physical exam that we do. So that's one way. The other way, of course, is for the patients to travel to a nearby clinic where they have nurses and therapists right there, and they can assess the patient, give me feedback,
Okay.
get my expert opinion as a CMT expert. That's one way to do it. The good part there is that there is someone examining the patient live and getting feedback. The caveat would be that you have to have a contract with that hospital or clinic and figure out how this can be done, and arrange the payment part and those kind of things.
Okay.
So you will have to build that relationship and network there. Some clinics, some hospitals have satellite clinics, and if it's a part of your own hospital system, you can go to that clinic and you can actually get care there, and some people are already doing that.
Okay. So
And the
how
yeah.
how do patients go about finding this information out? Is it best for them to contact their insurance company directly, or should they speak with their doctor to kind of coordinate all of this?
Yes, I think it should be a couple of things. I think first, of course, is to contact their doctors and see if they're able to provide this kind of service. If
Okay.
the answer is yes, then the second thing is to contact the insurance companies to see if the insurances would cover this kind of service.
Okay.
And only when you are able to get those two, I think it needs to go ahead and do them. Some medical centers, for example, they as they're building the telemedicine program, they will figure out which patients will benefit from it, which patients won't. So the doctor will be able to say that. Not all of them can do that, but many times the doctors are able to figure out which patients might benefit if the insurance coverage works out and so on.
Okay.
So again, there are different ways to do it.
So what would be some of the reasons why a patient would come to you for treatment? Would it be for prescription for AFOs? Would it be because they're experiencing pain? What are some of the examples that you can give us?
Sure. I mean, and you got the right point there. It's a combination of things that brings them in.
Okay.
I recently saw a patient. She comes from a smaller town. They drove 8 or 10 hours to see me.
Wow.
And they came to see because the people there had never heard of CMT. I mean, they would have heard of CMT, but that was in a book, but they never seen someone. And she was their first patient basically, and they were honest enough to say that they had no expertise in this. They didn't know what kind of treatment and whatnot.
Mm-hmm.
So she came to see us to get an opinion on what all physical needs she has, and she's very physically active. And so she wanted to know how the CMT will progress, how what to expect in future, how to get prepared for future, what needs are there currently, and what can we do to help her. So which is what we did with her. Some
Okay.
patients are referred to us because they have hands and feet which look like CMT, but they have never been diagnosed formally or never had a gene testing, so they just want an answer, so they're sent to us,
Okay.
and
And
we
then
do the treatment.
right. You're able to order like genetic testing from them?
Yes, we're able to get the gene testing done, figure out a diagnosis, and talk about prognosis and all of that.
Okay. Yeah, I think
Some patients, no
that's
good.
that's very valuable. I think a lot of people are kind of on the cusp of whether or not to be formally diagnosed and have the testing done. So knowing that there's telemedicine doctors available that can they can write this prescription, that can evaluate them virtually and kind of take a look at if they're experiencing foot drop or any of the typical CMT symptoms. I think that's pretty exciting.
Yes, it is. It is. I mean, again, these are all different ways that we can help our patients. And some patients are referred to us because they are fairly advanced. They need a wheelchair, and we can do a formal wheelchair evaluation, work with the insurances, get wheelchair for them. Some are referred to us because they're having respiratory issues, uncommon, but it can happen. Some are referred to us because they need symptomatic treatment of pain and other things. In many cases, it's a mix of things. It's not just one, but it could be certain specific things as well.
Okay. And I believe we have some slides here. I think we could dive in a little bit deeper into the subject. I think this was pretty interesting as far as the supply and demand for neurologists. I think a lot of people, a lot of patients are frustrated with the lack of knowledge, which you touched upon in the medical community. They're being misdiagnosed. They're just not that familiar with Charcot-Marie-Tooth. So I think this was a very, very interesting graphic that you had here.
Yes, I did. In fact, this talk I took from one of the talks I gave at AAN, and that's where I met many people from your organization, and they were really interested in this talk and this graph in particular. That's why I put it in there.
Yeah.
So I agree with you. I mean, there is if you can see, there is a big demand for neurologists everywhere. More than 20% demand. Of course, some of the areas in Northeast, including New York areas, are fairly saturated, but other areas, I mean, there's a big demand.
Right.
And in the areas where I am staying, there is more than 20% demand there. And that's true for many places. The So that's one thing. Again, among all neurologists, not everybody is familiar with CMT. So you see my point. Just because you're a neurologist doesn't mean you're comfortable with CMT and managing CMT. You need a multi-D team, and you have to keep up with the latest in the research and the genetic testing and all of that. And again, that may not happen with 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 many of the neurologists because they are busy with taking care of other neurological conditions.
This is
So
why I think our centers of excellence are so important. Like you said, it's almost like a one stop for CMT. You're able to see multiple practitioners in one visit that can evaluate you on different, um, you know, in different areas. And
absolutely, that was the key part I was trying to say, that we have shortage for neurology in even multiple conditions, and something for CMT, which is a rare disease which needs a lot of expertise. There is even more shortage,
mm,
and having centers of excellence like the ones we have with you makes us or puts us in a very unique position to provide care for a variety of patients, and also provides information for patients to figure out where they need to go to get that expert care.
right, and you already have, this set up network of HCPs. I mean, whether you can be evaluated, whether you need surgery, whether you need bracing, what kind of PT you need, pain management, all of that is it's multifaceted.
You're 100% right, and that's where I think uh, you know, and that's why we have patients traveling this long distances to come to see us, and that's where I think telemedicine plays a very important role in trying to bridge that gap.
Absolutely. Great. All right. I think we have some more slides here. I think this is, you touched upon some of the contracts with hospitals and some of the common practices.
You're right, and that's where currently, so the what I'm trying to show you here is that telemedicine is already being used for many other conditions, both in the emergency room and the inpatient. So it's not something new or experimental. It's been around for a while. It's just not reached its potential because of the various things that I mentioned.
Right.
And I think in our CMT world, it has a chance. It has a really good, a really good scope to reach its full potential. And these are all the different things that we can do with telemedicine. We can look at your medications. We can give second opinions about CMT, for example. We can communicate with your primary care on what needs to be done. You can stay home and we can monitor you there. uh, we can do lots of communication monitoring from home, and again, these are all telemedicine is right for all of that.
Right.
In terms of barrier, this has been one of the biggest barriers. I think once the reimbursement part becomes clear, I think there'll be more people adopting it. Some insurances, the malpractice insurances the doctors carry, as soon as they start practicing telemedicine, some malpractice insurance companies also hike up the insurance rate for the doctors, which again puts a barrier for doctors to get into this. But again, these are all, I think these are all temporary things that are happening, and eventually our care, and I think when I say our care, I don't just say for CMT. I think many other care will move that way, but for something like CMT, I think it would be helpful. And I think the biggest hurdle I see is probably Medicare. If Medicare changes its laws, I think everyone else will follow, and
Right.
this will be more widely accepted.
Yeah. I think there's just still some stigma around how effective it is. But I think the more discussions like this we have, and the more which education is out there, that it's just natural progression that it'll be moving more in that
Absolutely right.
direction.
And again, we like to do our exams, and I'm all for examination. But then again, there's only so much we can do with regards to checking reflexes and all of that. So
Mhm.
I think we need to understand the function of the patient in their home,
Right.
rather than see them like for a few brief minutes or an hour in the clinic and make a judgment. So I think that's where telemedicine has a bigger role. In the good old days, the doctor used to come to your home.
That's right.
Okay? I know there are some doctors who still do that in both rural as well as in urban areas. And
Wow.
they used to figure out what happened in your home and could suggest remedies as well as changes to your home based on what they are seeing. And we have lost that personal touch to our patients.
Absolutely important.
So again, telemedicine might feel that there is no personal touch because you are seeing a patient in the computer and you are not having that personal relationship. It may feel that way, but to the contrary, it may be more personal than you expected, because you get a chance to see the patient in their home and see what's going on in their home.
Yes, I think that's super important. I think more doctors should take that, your environment, into consideration I think it plays such a major role in our health.
Yes, they have to be licensed in the state they are practicing as well as licensed in the state the patient is.
Okay. So,
That's the barrier there. So if I'm saying I'm in Missouri and I'm licensed in Missouri, if the patient is say in New York City or New York, I need to see a patient there. I need to be licensed in New York, and if I'm not, then I cannot see that patient. So
okay.
that's the licensure part. But again, there is an organization called FSMB, which is basically Federation of State Medical Boards, where all the different licensing organizations are under FSMB, and they are trying to get all the states come under a single purview, where if you get license in one state, you are automatically eligible to get licenses in other state without having to go through the process all over again.
Right.
So I think that's happening in many states have joined that, and I think that will really that's the states that have joined. And I think this map is a bit outdated. I think there are quite a few more states joined, and I think that will eventually move that way. And my state of Missouri, for example, legislation has been introduced, and I know it's in the process of passing through and so on. So, but uh, again, there are that's where this will head to. I think once we do that, we will, one of the big barriers will come down.
Absolutely. Yeah, that's a big one. I think we had a question here, or a comment. My son's pediatrician uses telemedicine, which turns out to be pretty useful during off hours when you can't bring them in. Gives you peace of mind or lets you know if it needs more attention. So
Absolutely.
yeah. So is that something as well? I mean, are there appointments off hours, or is it still traditional office
No,
hours?
it can be done off hours as well. So there was one more model I wanted to discuss,
Mhm.
which we are doing for some disease states already, and CMT again might be a good one. Um, one of the things that we are doing is uh, you can actually have a recording of the clinic encounter. So basically, you can go to your primary care doctor, discuss your condition, your concerns. The primary care doctor may or may not know answers for all of them, but you can have that recorded. You can send it to a consultant, CMT expert, who can view that recording of your interaction and give opinion on the places where the primary care doctor didn't know or wanted an expert opinion. We call that store and forward technique,
Oh
where
wow.
you can store it and forward it. And many states, some states are reimbursing even that. So I mean, that would again really, you get the peace of mind of it's like buy one get one free there. You see my point?
Yeah.
So that's
You get a second opinion, basically.
yeah, basically right there. And it's that's a really useful technique. And yes, and it can be done off hours. You don't have to have it. Uh, the consultant can look at the encounter anytime they want, give their opinion. You don't have to worry about traveling. You don't have to worry about going to the clinic, being on time. So basically, you're getting a second opinion, a live second opinion, without the hassles of distance and travel and all of that. So yes, I mean, that's the advantage of that. I mean, I definitely agree that it can be done off hours. There is no the only problem with off hours, for example, with CMT, is that if you want all your therapists to be there to see your son, for example,
Mm,
or your loved one, they won't be able to come because they typically have a 8 to 5 kind of job.
right.
So they have to be there during the clinic time so they can come and look at them, give their opinion on what needs to be done with the bracing and so on. That's the drawback of it.
Okay.
With this store and forward, for example, all these therapists can look at them at different times and give their opinion as well. So
And this
um,
is all on one platform, all of this?
yes, all on one platform, and again, those are evolving. They are not yet like really taken off, but they are all evolving. Especially in the ophthalmology world, for example, when you see an eye doctor,
Hmm.
you want a second opinion on something going on in the eye, they can do this. So they have been doing it really well in the ophthalmology world. They are doing something similar in the dermatology world. But I think CMT again is very ripe for those kind of interactions.
Right. Okay. And these were just some of, I guess, the standard protocol for.
Yeah, so people always worry about losing that human touch. So we came up with this word called website manners. We have
Mm.
bedside manners, we have website manners.
That's great.
So um, and the we have many things that we have put here, but again, maintaining that eye contact is a key. Whether you are on computer or whether you are in face to face, having that eye contact with the patient is really key. And sometimes when you are doing telemedicine, it looks like the doctor is not looking at you and telling you, and that's really, you lose that relationship.
Right.
So we really emphasize about these things in our interaction. Keep the cameras away, keep the wires away.
Yeah.
Have a neutral background, explain who you are, explain your role, introduce yourself, and all of those. And again, this is with regards to what can be done. So say if you are in your home, you can, or the patient is in their home, you can directly observe what is going on with the patient and report that. But if the patient is in a clinic or a nearby doctor's office, there is somebody there, whom we call a telepresenter. They can examine the patient, look at say if there is a pressure ulcer developing, is there a callus developing, they can give some of those as well. And we can get more information from both of those. Some we may or may not be able to assess. So for example, in CMT patients, for example, if the patients are developing contracture and you want to feel how tight it's getting, unless you feel it, you cannot give a clear opinion on that.
Mm-hmm.
You have to rely on telepresenter there, whom who knows, hopefully who knows what they're doing.
Right.
So those kind of things can become a bit problematic, but again, there are workarounds around all of those. So, but again, in real live exam of a patient, nothing beats that. We all agree with that. But what do you do when there is shortage? What do you do when there are not many experts? What do you do when you have to travel long distances and you have many things going on?
Yeah, and we hear that a lot on social media. Just there's no one in my area who knows how to treat me. So I think there's just a very high demand for this kind of care and education. And also, we had a question here. Do you follow up with emails and phone calls after?
Yes, I mean, when you say emails, for example, many of our patients have an access within our, they have their patient portal. So that's the one that we use. And of course, phone calls definitely, yes. If the patients have some questions if they're not addressed, then yes, we are more than happy to answer those questions through phone call and so on. So those are kind of things. And one thing I in this part I really want to put forward is that we want to make sure that patients and providers alike advocate for telemedicine, because if you are, once you understand its pros and cons, if you are able to advocate for it locally, nationally, I think it has a tremendous potential. So I think for us, that's the biggest thing we want to. What I discussed, that we can do it in your home, you can do it in a nearby clinic, or we can even do store and forward. And there was actually a recent paper where they did the store and forward on ALS patients. The ALS patients had seen a local physician, and the videos were viewed, or they had a video of what was going on done with them prior, and the doctor looked at it later on and gave an opinion. And so it's already been done in the ALS world, and patients seem to like it. They didn't have to come all the way, wait for the physician, get roomed in, find a parking, and all of that kind of thing. So I think there's potential for this, and and I think we in the CMT world, we just have to move forward with it. We have to understand the pros and cons, but move forward with it. I think there's a lot of potential for it.
Yeah, I think we have some incredible tools in our hand with iPhones now, and just the way that we can just casually capture video. I think a lot of times also, we'll kind of try and explain a symptom or if something's bothering us to a doctor, but to be able to videotape it, in action, let's say you're having trouble going up and down stairs, you can't always show that in a clinical setting to a doctor, but if you're able to share video of you and actually in your everyday life attempting to do things, and I think that could probably provide a more powerful testimony and information to the doctor as well.
Absolutely. I mean, that's the key part of all this. You have to assess the function, right? So it's not just a physical examination. I think that's where the CMT world is moving. That it's not just doing a routine physical exam. It's trying to assess the function and the
Right.
functional limitations of the patients, which is affecting their quality of life. And I agree with you, having those videos of what's going on in the home makes a big difference. And I ask my patients to make some of them. One caveat is to make sure the videos are sent in a HIPAA compliant way. You see my point? And the telemedicine provides a HIPAA compliant way to do those kind of things.
Okay.
I, for example, never tell my patients to send their videos like online or something. The patient portal that we have, it provides a secure way to send videos, so we use that. We don't use anything other than that. So that's something to keep in mind. But again, you are 100% right. We have a lot of tools that give us real life input and
Mm-hmm.
data as to what's going on with the patients in their home and in their settings where we need to assess them.
Right.
And I think we are yet to make full use of them.
Yeah.
But I think telemedicine, whichever way comes out, I think is a way for us to understand.
Yeah. And then I think there was one more question we had. How does someone go about making a telemedicine appointment? Is it through the platform itself? So they would just get the link and then the appointment would be booked that way as well?
What do you mean by, like, how do they make an appointment, for
Yeah.
example?
Hmm.
Everybody has it in a very different way. Um, Ideally, when we see a patient for the first time, we would like to see them in person, just to get an understanding of who they are,
Right.
assess them, get a baseline. And from there on, if the doctor, like for example, thinks that the patient would be a good fit for telemedicine, many clinics are able to do the telemedicine appointments and basically give you access to a secure link, something similar to like the Zoom, where
Hmm.
you can log in and talk to the doctor on the day of your appointment, time and day of your appointment. So many clinics are able to do that themselves. Some clinics, for example, um, they allow you to schedule yourself, where you can choose whether you want a real life or a telemedicine kind of clinic, uh, live or a telemedicine kind of clinic. But again, those are far and few in between. In most cases, in our world at least, we would see the patient, get a baseline, understand who they are, what's going on with them, assess their needs, and from there on, the return visit should be done through telemedicine. If the patient, of course, is a good fit for it, if the insurance is able to cover, and all of those.
Okay. Yeah, fantastic. I think this is very exciting. I think it will benefit a lot of patients in our community, especially, on the diagnosis side. And like you said, I think this is where our future is going. Our virtual world is being more and more meshed with our everyday reality. So I think we need to continue to use technology to our benefit. And I think this is just another tool that we have at our hands that we should be utilizing more. So I thank you for your time. And how can people contact you if they'd like to make an appointment or speak with you a little bit more?
Yes. So one of the things that they can do, for example, is they can email me. Is there a way we can send my email to all our patients and so on? I mean, I that's my personal, my office emails. I'm fairly available by that. So,
Okay.
and I've had patients actually email me in the past, and I cannot do medical consultation by email. I would say if patients do send me an email, I will say, please send a referral paperwork to my office and we'll set up an appointment and so on.
Right.
So that's one of the ways they can do it. They can call my office as well. But I think if the patients email me
Okay.
and start the process, I will say where to send the referral paperwork and so on, so we can move forward with it. Definitely, thank you, and thank you again for the invite. I really appreciate it, and I know it's later in the evening for you guys there, and so I really appreciate your time.
Yes. Well, thank you. We got some great feedback today. I think it was super helpful. And we encourage everyone to just look into the idea of telemedicine, contact your insurance companies, speak with your doctors, and just even do your own online research and see if it's a possibility for you and for treatment. So thank you so much, Dr. G.
Thank you. I really appreciate it. Take care, guys. Thank you. Bye bye.